This, asked Dr. Dury, is a response to a very common question in this time of the COVID-19 crisis. Many myeloma patients are asking, is it okay, is it safe for me to go back to my myeloma clinic for my regular appointments? Obviously, a very important question. And unfortunately, the answer is maybe yes, maybe no, because right now, if you happen to be in a high-risk area, for example, New York City, then there are still significant risks in going out and about and traveling and perhaps coming in contact with someone who could put you at risk for exposure to the COVID-19. And so it is extremely important to assess the situation in your own local city or town. As you're thinking about the pros and cons of going back to the myeloma clinic, it's important to ask a few questions. So the first one would be, is it necessary for me to have a COVID-19 test done before I go back to the clinic? And in a number of places, for example, in New York, it is necessary, and some clinics are actually requiring that you have 2 negative tests done for the COVID-19 infection before you actually go back into the clinic. And so this raises the point of, well, maybe I can continue or start to just have my follow-up using telemedicine without going back into the clinic. And I recommend this discussion as a first step for all patients because increasingly this can be helpful to reduce the number of visits and also is very, very reasonable for ongoing care for patients who remain stable. Another question to ask as you're talking to the doctor or to the clinic staff is, do you have full protective equipment ready? Will the staff be wearing masks? What is going to be the setup when I come back into the clinic? And will I myself have to be wearing a mask? What will be the procedures if you would go back into the clinic? Obviously, for some patients, especially if a patient has been newly diagnosed or if the disease has relapsed and it's urgent to get some treatment, it is very, very important to sort out those details so that you can get back into the clinic and get back into a full treatment program as quickly as possible and as completely as possible. And so these are very, very important points. And so the bottom line for this is that please think about this carefully. Review the option for a telemedicine approach where you can see and talk to your doctor on video or at least talk to the staff or the doctor on the phone. But review carefully what is going to be the ongoing plan for both testing, getting your lab tests done, and treatment with your doctor so that you have a clear ongoing plan.